Hey everyone, we've got another heart today. This is number 1511 in our collection. And we'll start off by looking at the main phenotypic features of this heart, a quick teaser or preview, if you will. And to do that, we'll go ahead and open up this right-sided ventricle here, which does have coarse trabeculations consistent with a morphologic right ventricle. And when we do that, we immediately find that the aortic valve and the aorta arise from this morphologic right ventricle. And then when we find the pulmonary arteries and the pulmonary trunk, and we put the probe down the pulmonary trunk, we find that in fact the pulmonary trunk also arises from this morphologic right ventricle. So here where the probe is coming down from the pulmonary trunk and the pulmonary valve. Here is the aortic valve and the aortic root, and then they both arise from the morphologic right ventricle in their entirety. So this is double outlet right ventricle. Although remember, the fact that both arterial trunks are rising from the morphologic right ventricle in entirety doesn't necessarily make that double outlet right ventricle. They can be a spectrum of how much of each arises from the morphologic right ventricle. So it isn't necessary that 100% of both of the roots have to arise from the morphologic right ventricle. But in this case, they do. And then here is an interventricular communication, which is neither close to the aortic valve, nor is it close to the pulmonary outflow, which is right here. So this, in fact, is a heart with double outlet right ventricle and a remote or non-committed interventricular communication. Now let's place the heart back how it would have sat in the chest. Anterior surface towards the screen, posterior surface towards the turntable, head are superior here, legs are inferior here, left over here, right over here. I usually like to find and start off by identifying the right atrial appendage, or at least externally what appears to be the right atrial appendage. And in this heart, when we do that, we find immediately that the right atrial appendage and the left atrial appendage both sit on the left side of the great vessels. And so there, in fact, is juxtaposition of the atrial appendages. So there's one atrial appendage here that's more broad-based, more triangular in shape, more pyramidal in shape. And then there's one here that's more finger-like, more tubular in shape. So this would be consistent, at least externally, with a morphologic right atrial appendage. And this, at least externally, would be more consistent with a left atrial appendage. So now let's try to find the actual right atrium. And it appears that this, in fact, is the right atrium here. And we are now looking into the morphologic right atrium. If we look down it, we can see a AV valve here. Well, let me try to open this up a little bit more. All right, so here is the vestibule of the right atrium. And when we look inside this right atrium, we do find that there's an orifice here that actually leads to the right atrial appendage. So once again, here is that orifice to the right atrial appendage right back here. Okay. And then next to it, we see the atrial septum. And let me try to open that up a little bit. And we do find that there is an oval fossa type interatrial communication. So here's that intraatrial communication in the oval fossa. And if we put our probe through that, we find that the probe does in fact exit the left atrium. So let me try to demonstrate that a little bit better. So here is the actual interatrial communication, which is an oval fossa interatrial communication right here. And then down here is the orifice or the mouth of the right atrial appendage. We'll take a look at the right-sided atrioventricular junction from the ventricular aspect, since it was hard to actually look into the atrium. And we find that the right-sided atrioventricular junction is guarded by a valve with 3 leaflets, 1, 2, and 3. And that this valve does seem to have some septal connections, which makes this a morphologic tricuspid valve. So here is the septal leaflet. Here's the anterosuperior leaflet, and then here is the inferior leaflet of the tricuspid valve. This is a morphologic right ventricle. There are coarse trabeculations. And immediately we see that, in fact, the aorta is the more anterior great vessel and arises from the morphologic right ventricle. And right behind it is the pulmonary trunk and the branch pulmonary arteries. Now, when we put our probe down the pulmonary trunk and through the pulmonary valve, we find that, in fact, the pulmonary trunk also arises from the morphologic right ventricle. So this is double outlet right ventricle. And the next question becomes, is there an interventricular communication? And the answer to that question is, in fact, there is. And here is that interventricular communication. And it is remote from both the pulmonary outflow tract, which is right here, and the aortic outflow tract, which is right here. So this, in fact, is double outlet right ventricle with a non-committed or remote interventricular communication. Why don't we take a look at the ventricular arterial junctions here? And here we come across an arterial valve, which we know is the aortic valve. We can see the coronaries rising nicely from within the sinuses of this valve. And as always, interesting to point out that the arterial valves do in fact have this kind of crown or semilunar appearance to their actual support structure. That there are these interleaflet triangles that are wedged in between these half-circular semi-lunar fibrous valvar leaflets. There is no true round or oval annulus to the arterial valves, although that's not to say that the round or oval so-called annulus that we create by imaging isn't a helpful tool. It's simply just not a discrete anatomic structure. So here's a 3 leaflet, 1, 2, 3, 3 sinus, 1, 2, 3 aortic valve. Here are the coronary arteries arising from within the sinuses. And then here is the ascending aorta. Here is the transverse arch. And then here is the descending aorta here. Now, it's going to be hard to actually see the pulmonary artery, but here is the pulmonary trunk behind or posterior to the aorta. So here's the aorta. We'll flip that down, and then here, in fact, is the pulmonary trunk. And we can see the branch pulmonary arteries. Here's one, and then here's the other. If we put our probe down this, once again, we see how blood flow got out of what appears to be a fairly stenotic outflow tract to the pulmonary trunk. And once again, entirely arising from the morphologic right ventricle. We'll go ahead and flip this heart over. Here is another atrium. This atrium is smooth-walled, and all of the pectinate muscles are confined within the appendage itself. And here's that left atrial appendage. It's all consistent with the morphologic left atrium. Here's the flap valve of the oval fossa, and you can see that there in fact is a oval fossa type intraatrial communication, seen much easier from this side than the other side. And these are the horns of the oval fossa. We see that the left-sided atrioventricular junction is guarded by an atrioventricular valve that appears to have 2 leaflets. 1, 2, and that there are no direct septal connections between this left-sided atrioventricular valve. Sorry, it's a little bit out of focus. There we go. This left-sided atrioventricular valve and the ventricular septum, consistent with the morphologic mitral valve. Here's the morphologic left ventricle with its fine crisscross trabeculations. And then here's that remote or non-committed interventricular communication from the left. And you can see that there is no other egress from the morphologic left ventricle except for this interventricular communication. So we have a heart that has juxtaposition of the atrial appendages, as well as double outlet right ventricle with a remote or non-committed interventricular communication.